Well, we continue with the cleanup after Irene's devastation, but there is more than just cleanup to keep in mind in the coming days. It's also important to remember your health and your wellness. So here to give us some expert advice on staying healthy after the storm is Dr. John Pettini from St. Francis Hospital. Good to see you, Doctor.
Good morning.
Thanks for coming in. During the break, we were talking about that this generally happens in 3 stages as far as injuries. There's the injuries that people sustain during the actual event, and then some during the cleanup, and then you have more of a chronic health situation. Want to run through each one for us?
Sure. Usually in any kind of a natural disaster like this, we would anticipate there could be a varying degree of severity of injuries from the storm itself, debris, structural collapse, flood waters, and what goes with that. Fortunately, we haven't seen really much at all in our Hartford area. I think other ends of the state that had higher winds probably saw more of that in their emergency departments. The second phase that we come into fairly quickly, and the phase that we're in now, is the cleanup phase, and you'll have a lot of people out using chainsaws that haven't picked up a chainsaw in a long time.
Right.
Just sharp debris that's laying around, and things as basic as just exacerbation of back injuries and strains from all the cleanup or exertion, and it reveals cardiovascular problems that weren't previously known. So pay attention. It's the same advice as when we've been on speaking to you in the winter. If you are feeling exertional symptoms of fatigue or you're feeling chest pains, you should take that seriously and seek treatment.
Maybe hire somebody. I mean, if you've never used a chainsaw in your life and you're not really good with that kind of a thing, maybe that's not the best choice. Wear gloves, I would imagine, things like that. Maybe eye protection if you want to move some light, different items. You never know. You get splinters and nails and things like that.
Absolutely. Personal protection is first and foremost.
Then the third phase is the chronic health, and this is a situation where maybe somebody runs out of medication or can't get to a doctor's appointment, right? Talk about that.
Exactly. Fortunately, in this storm, we had a lot of early warning, and I think the media did a fantastic job of telling people prepare, restock on their medications, don't wait till the last minute. What usually happens is if the infrastructure is very wiped out, where people can't get to the pharmacy, can't get to their doctors, they'll run out of their chronic medications. But in a situation we're in now, it's sometimes just with the power out for a few days, is diabetics get off their usual diet, people with congestive heart failure get off their usual diet, and maybe don't have access to their medications, and we'll see an exacerbation of these chronic health problems. After Hurricane Katrina, for instance, there was a wide-scale loss of the infrastructure, so we saw a lot of chronic medical problems for weeks and weeks after there.
I know a lot of people are wondering, how late can I go with the food in the refrigerator? It's now been a couple of days. At what point do you just say, I need to throw this food out, it's better to be safe than sorry?
Yeah, good point. I mean, foodborne illness is a big concern when we're so dependent on modern convenience of electricity. So really, meat, fish, perishables, 4 hours unrefrigerated, you pretty much have to throw it out. So at this point, if you've been without power, you really have to discard what's been in the icebox.
Are you getting any problems with people using generators because of the carbon monoxide? Sometimes they put the generator down in the basement and they think they're fine, and then all of a sudden they're not, and they start to get woozy or vomiting, things like that.
As of this morning, I don't believe we've gotten anybody, but it's almost a guarantee, is that we'll have the generators and alternate heat sources in the winter will cause these problems. You can't smell carbon monoxide, it's odorless, it's colorless. You might even have your garage door open and think that's enough to vent it, but it truly has to be about 50 feet away from the structure, the exhaust, because you just don't know where the exhaust fumes are going.
Sure.
So it has to be well ventilated.
Dr. John Pettini, we appreciate it, from St. Francis.
Thank you.
Hopefully you won't be seeing a lot of people in the hospital, and everybody's going to be just fine.
Hope not. Stay safe.
Audrey, over to you.
All right.